With respect to ACOs and Medicare coverage, this is really exciting. This is one of the things I've been waiting for a long time. And cheers to Howard Kessler, who was standing to the left of President Trump when he signed the executive order back in December. And Paige Figge was on his right, talking about CBD. And it's not just about cannabis, because everybody that starts with cannabis should be starting with CBD. When you have a floor of protection with the CBD, you're able to tolerate the THC. The THC is going to work better at lower doses. The CBD is going to work better with trace amounts of THC, which is why we need to advocate for full spectrum CBD. There should not be just isolate CBD, what some of the laws that they're talking about come November. On November 12th, we're going to see what happens, but I hope that this is solved long before that, so there's some certainty with respect to business planning and when it comes to CBD companies. But the ACOs, the Accountable Care Organizations, so these are health professionals that work together to give patients high-quality, coordinated services to improve outcomes and manage costs. So I remember in San Diego with Scripps and Sharp and UCSD, some of the first ACOs in the region, and it was all about doing more with less. How do we take better care of people? And that really talks about more patient-centered care and listening to the patient rather than that top-down barking orders and expecting them to just follow. How do we improve outcomes? That's the number one thing. And sometimes this is with respect to specific conditions like cancer or pain management, neurodegenerative conditions. I mean, the sky's the limit when we think about cannabis and how we can go into ACOs that are trying to have better outcomes with less costs. And now bringing in this BEI, the Substance Access Beneficiary Engagement Incentive. This is a model where providers are going to educate patients about cannabinoids, talk to them about the risks and the benefits and how it's going to work together with the rest of their treatment plan, and then monitoring them, making sure that they're having tracking. And this is something that we've been doing for years, giving people tracking logs, saying 1 to 10, where are we at on pain, anxiety, sleep, memory, focus, energy levels, your blood pressures, your blood sugars. All of these things are involved, your appetite. And even some of the soft things, like, are you a better person? Are you showing up better at work? Are you kinder to your spouse? Going back to
yourself.
Are you kinder to yourself? Going back to alcohol, one of the most hazardous days is the Super Bowl, because everybody drinks to excess, and generally women especially are at risk. You don't ever have that from cannabis. But anyway, so this is the initiation of thinking how we're going to cover this as a medicine. And it's really, really exciting to think that insurance coverage is going to be covering CBD. And the gist of this is $500 a year is the initial offering. CW Botanicals is, of course, America's CBD brand, and they're at the table with the government. And then Realm of Caring is going to be helping with tracking and oversight. But there's going to be a lot of roles going back to nursing. There are ACOs all over the country. Generally, they're in the metro areas, so some of the more urban areas in America. But they're going to be coming to more and more places. And CBD is something that we're going to be covering. So anybody got any comments on this?